Today, I am going to discuss about corneal abrasion. So a corneal abrasion is a scratch on your eye and it commonly occurs in the epithelium of the cornea.
The cornea is the transparent dome-shaped window that covers the front of the eye. It has 5 layers. The thin top layer, called the epithelium, is composed of sensitive cells that are similar to skin. It is richly innervated with sensory pain fibers from the trigeminal nerve, so most patients with corneal abrasions are in obvious pain. Below this surface layer lies a tough protective structure called the Bowman's membrane. They are the 2 layers most involved in corneal abrasions. The next layer is the stroma. So it is the thickest layer and primarily consists of water and collagen. The collagen gives the cornea its strength and elasticity. Descemet's membrane. It serves as a protective barrier against infection and injuries. The last one is the endothelium. It pumps any excess fluid out of the stroma and prevents swelling, resulting in a thick and opaque cornea.
So what causes corneal abrasions?
Like walking into a tree branch, poke your eye with a fingernail, or get dirt, sand, or foreign matter inside your eye, get chemicals inside your eye, or rubbing it too hard because of lack of sleep, or removing dust or irritants, and also wearing poor-fitting, dirty contact lenses.
So the patient usually comes in with a chief complaint of eye pain.
Symptoms include discomfort because of foreign body sensation in the eye, a teary red eye, pain with extraocular movement, blurred vision, headache, eye twitching, and unusual sensitivity to light or photophobia.
So how do we diagnose corneal abrasions?
The doctor will examine the eye with a light to check for any obvious corneal injuries or other foreign objects. To confirm this, a slit lamp examination with fluorescein is used. A small drop of a yellow-orange dye called fluorescein is placed into the eye, and this dye will cause any area of abrasion to look greenish under a cobalt blue light. If ocular penetration with retained foreign body is suspected, such as a high-velocity injury, then an ocular CT scan or ocular MRI or both are indicated.
So how are we going to treat this? If you think that you have a dust or dirt in your eye, avoid the urge to rub it. If you are wearing contact lenses, remove them immediately. Then try washing your eye for several minutes with clear, clean water to see if this relieves the problem. If this strategy do not relieve the symptom, consult the doctor right away.
Routine use of topical antibiotics for corneal abrasions remain controversial because the ointments may retard corneal epithelial healing. However, to prevent infection from developing in the injured area, the doctor might still prescribe it because the epithelialized cornea is more susceptible to infection than intact ones. Fluoroquinolones are probably the most common agents used for prophylaxis with corneal abrasions because of their broad spectrum coverage and low toxicity. For large or dirty abrasions, many practitioners prescribe broad-spectrum antibiotic drops such as trimethoprim, polymyxin B, or sulfacetamide sodium. Abrasions due to contact lenses warrant antibiotic treatment because of their propensity to progress to infected corneal ulcers. Coverage for gram-negative organisms, especially Pseudomonas species, with agents such as gentamicin, tobramycin, norfloxacin, or ciprofloxacin is recommended. Antibiotic drops are more comfortable than ointments, but it must be administered every 2 to 3 hours. Some ophthalmologists advocate the use of diclofenac or ketorolac drops with a disposable soft contact lenses in addition to antibiotic drops. This therapy may be an effective alternative to patching, as it allows the patient to maintain binocular vision during treatment and reduces inflammation. Patients with minor abrasions usually require a strong oral narcotic analgesic initially, such as hydrocodone, bitartrate, and acetaminophen, and oxycodone and acetaminophen. But if with tolerable pain, acetaminophen or ibuprofen or another non-prescription pain reliever may be taken to treat your eye pain. If your eye is overly sensitive to light, or if your eye pain is not relieved by non-prescription medications, your doctor may prescribe drugs called cycloplegic drugs. Specific agents such as cyclopentolate or atropine, drop or ointments are useful adjuncts. These medications will relieve your eye symptoms by temporarily reducing the activity of muscles that control the size of your pupil. If treated immediately, most corneal abrasions result in full recovery with no permanent damage.
So avoid wearing eye makeup and contact lenses until your corneal abrasion completely. So how are we going to prevent it?
Carefully trim fingernails. Use appropriate protective eyewear fitted by a professional. And clean your contact lenses thoroughly, and don't rigidly rub your eyes.